Good morning, my name is Marco Scarci and I'm a consultant thoracic surgeon at Papworth Hospital in Cambridge. I'm the director of the Cambridge International VATS Symposium, and on behalf of the hospital, myself and the two co-directors, I would like to welcome you to the second International VATS Symposium in Cambridge. I'm very grateful to all the delegates that decided to spend 2 days with us, and to the faculty composed by international surgeons that came to Cambridge to discuss the most up-to-date topics in minimally invasive thoracic surgery.
When you read an article, that's great. But it isn't until you actually see live videos, in other words, they're shown live with the person who did them, and be able to find out, why can't I do this that way? I think that's the real value of symposia like this.
Do you have a good view of the position of the surgeon and the assistant from outside?
I'm pretty impressed. In just one day we can actually cover so much. That's very important. We've seen things from uniportal, non-intubated, subxiphoid microlobectomies, and that's a really satisfying experience in just one day.
I find symposia where I can interact with the faculty, we're here all day, we're around each other all day, extremely beneficial.
It looks like you are dividing the serratus. Would it be possible to just separate the fibers?
It's going through the digitation of the serratus anteriors.
Thank you very much.
We had a great day today. It was very challenging to have people from different countries and continents in the room. It was a great learning experience, and I'm looking forward to the third VATS Symposium.
Oh, today, fantastic. Great content of the lectures, great football by the stand, and great cakes as well to go with the coffee. Fantastic. Thank you, Marco.
It's really nice, thank you. Really good for us. We are training, so it was a really nice conference so far.
I think the Cambridge International VATS Symposium is a huge step forwards because VATS is increasing in use, popularity, and it is a great focal point for international surgeons to congregate at a single place to exchange views and ideas about the current status and the future progress for VATS surgery.
So I think the immediacy of live surgery as a time-tested method of teaching is really unparalleled.
To see an expert actually do it live, to see not only where we're very good, but also where we're sometimes clumsy, that actually is a great learning experience. And I think if I was learning VATS today, I would love to come to a course like this.
Look at that picture. Whoa, I guess you guys are salivating in the audience right now.
That's for you, Alan. It's
Thank you, Marco. Who you are.
a gift to our guest surgeon.
What one person does, someone else might do better, and as a trainee, it's good to accumulate these different points of views and how you may develop your practice in the future. So it's been really good with the live surgery. Having world leaders in their field, different types of VATS approaches, has actually been very inspiring and kind of driving me to lead or go into thoracics longer term.
And from the established consultants and the operating surgeon, the trainees can really derive the best knowledge possible at this point in time. This is the future. And we're very happy to be here in a time that the future is unfolding ahead of us.
So I think we've got some insights into how VATS surgery may change in the future, and I think the downsizing of instruments and cameras is probably the way forward as well.
Yesterday when we talk about microlobectomy, also the using of energy devices such as ligature or harmonic, the discussion was very interesting.
I don't know the return of images you got there, Marco, but from here actually, even with the 5mm scope, the view is quite nice. The definition is really nice.
I think we can see quite nicely too.
The day was full of new interesting conversation and new ideas, and that was very nice to see all my old friends from different parts of Europe and even from United States.
Hi, I'm Ellie from the Thoracic Marketing Team at Covidian, now a part of Medtronic. We're really proud to sponsor this event for the second year running. It's been really great for us. We've had a lot of interest. Great to hear about innovative techniques in procedures this year. So yeah, looking forward to being here next year.
And this is a good setting for it. You're meeting the people who are pushing the boundaries, and then you can ask them, well, how can you push them further? So
this is one of the most interesting VATS course I ever tried.
The additional middle lobe vein goes from the inferior.
You know, I just don't want to change my retraction.
Yeah, I understand.
Very interesting for me, especially because I'm just starting now as a fellow. Really high scientific program this year. We had a lot of fun as well.
The initial feedback that we had from the people that attended has been really positive. We are already looking to have the third edition again here in Cambridge, and I hope you can make it next year to make this program better, more interesting for everybody.